The 0 percentile cutoff introduced for the last round of NEET PG 2023 has turned out to be a much debated topic. In clarification, Union Health Minister Dr. Mansukh Mandaviya, in an interview with Bharat TV, said that a 0 percentile cutoff doesn't mean a student with 0 marks would get admission, but it simply means that as long as seats are not filled, the counseling would go on. Hello, this is Abhipsa Monte and you're watching Straight Up by edX Live. Dr. Mandaviya reiterated that a 0 percentile was introduced only to fill up medical college seats, as several seats remained empty every year, and even the Supreme Court had expressed its displeasure over the matter. However, while most from the medical fraternity welcome the move, others are not satisfied with it. One such section is that of the foreign medical graduates. Since the cutoff of the foreign medical graduate examination has always remained strict, the students who completed their medical education abroad alleged that lowering the cutoff percentile to 0 for Indian medical graduates is discriminatory towards them. They also mentioned that the FMGE is an extremely difficult exam, and when this fact is combined with the high cutoffs, the result is that only a few of them, about 10% of the total takers, qualify each year. Aldrich Adnois, a foreign medical graduate from China who passed FMGE in July this year, shares his concerns. Let's listen in.
Our degrees are not similar to those products that you buy online or consider as cheap. And foreign medical students are not third-rate students. It's really heartbreaking and alienating when we are being despised for choosing to study abroad. Yet those students who follow these trends right now are considered as risk takers and adventurers. The number of students choosing masters in foreign countries after MBBS have also increased right now. So when these students come back to India, will we discriminate them in the future? So this discrimination against FMGs are really irrational. When we talk about the FMG exam, it is one such exam that casts a darker shadow than its size. And students prepare in real confusion surrounding what subjects will surprise them. And even though there has always been a rise in the difficulty, honestly, the real reason why students fail is due to fear. They prepare based on a weightage scheme that is rarely presenting as promised. Students always leave in a state of shock and disbelief after each exam. So this is a fight for equality and fair consideration. This is a fight for equal opportunities. Why are the FMGs being denied provisional registration and their chance for internship? Aren't we also students from the home country? Haven't we studied as hard for these exams as the students in India are also studying hard for their exams? So where is the love and acceptance for us? Why are we being alienated? Why are we being made to stand lonely?
Further, Andrew Matthews, president of the Foreign Medical Graduates Parents Association, alleges that the National Medical Commission has always been discriminatory towards the FMGs on grounds of quality. This is what he has to say.
Meaning that there are no sample questions or previous year's question papers are available, or not even the exact answers of the questions, as the answer key is always hidden. How is it fair to them? And number two, the confusion regarding the next examination. The next examination, which is expected to ensure a minimum standard to the medical students in India. We admit that the next examination needs some modifications. Even then, the next exam would have given the FMGs a fair chance to prove their merits, but it has been deferred until further orders. We request the authorities to conduct the next examination soon with more proper modifications. And until the implementation of the next examination, publish the answer key of the FMGE examination.
He also opines that the national exit test would allow the students a fair chance but since it has been deferred till further notice, the FMGs dwell in confusion.